Guys can always scoot up. There's a lot of room here. Now I feel like I'm teaching an undergrad class again. So I'm Dr. Nikhil Rao. I am a child and adolescent psychiatrist. I work with critically ill and chronically ill kids. And every now and then I end up assisting in surgery, which is always a bad thing. I'm the most useless doctor on the floor. But I'm basically here because I'm a subject matter expert for a few authors. I would love to actually create on my own, but I'm busy saving babies in the hospital. That's
How do I beat that?
By having a tour publishing deal.
Yeah, there you go.
There you go.
That one works.
So I'm Darcy Stone, and I'm here in two capacities. Last year I was the grand prize winner for Writers of the Future, so that was cool. My story was a medical thriller, and then my day job, I teach high school science, so I have a background in earth, space science, as well as physics and chemistry.
So my name is Ben Hewett, and I have 4 novels out on Amazon. I'm a self-published author. I pay the bills by working for NASA, so that I don't have a tour publishing deal. Notice I pointed it out. Right now my job I work in aircraft operations with pilots and astronauts, some of who are flight surgeons. So I'm around this stuff. I absorb some of it by osmosis, some of it by interest, but not a doctor either.
Okay, I'm actually going to try something that Mary Robinette did yesterday that I really liked, and that was she opened up the panel by asking what some of your questions are, because that way, as we discuss things, we know what you're interested in. So, are there any specific questions you know you've already come with?
One of mine is, how do you control loss of blood? You have zero gravity. How does that manage in the surgery?
Okay, so blood loss.
You got any suggestions?
Yeah, they're trying to figure that out.
How do they handle a lot of the standard coagulants and stuff? All of the because powders are a problem. How do they handle all of the medicine or the gauze or the things like that that could float around and
Okay, so just kind of the logistics of
of the debris. I suppose.
Tool control and debris is a big issue. I mean, even in a non-surgery environment, astronaut leaves a tool. The tool migrates.
Yeah, you can come back for it. Where'd you go?
And if they're working fairly quickly, they can grab that tool and use it again. In a surgery environment, you don't want any kind of drift because of the level of focus required.
Okay, so yeah, we'll get there. Sorry.
Oh, I was going to just follow up with that, unless if you were answering his question, then.
No, sorry.
Yeah,
I think Darcy wanted.
Yeah, let's kind of get a handful of questions, and then we'll kind of have a bigger discussion.
Well, we do have like the idea of spinning a spacecraft around, so there's a level of
okay,
gravity.
So kind of the artificial gravity.
With that kind of artificial gravity, will that kind of cut out a lot of the concerns about working in a vacuum environment?
Depends on how you do it.
Yeah.
Is dealing with things like a ruptured appendix or massive trauma any more complicated in zero gravity, or if you have to go fishing for bits?
Okay.
What are some of the common injuries that you might have to treat in a surgical environment? What might you run into in zero gravity, in space, whatever?
So going back to the ruptured appendix, your bone loss in a microgravity environment is going to encourage appendix issues. So right there, we've kind of already got an answer.
Okay, we'll take the last two, and then we'll start on the
creative ways to compensate for the thrust imparted by arterial spray.
Okay, so kind of back that blood loss.
How much surgical equipment is dependent on gravity?
Okay.
All of it.
All of it.
All of our technology, pretty much. Okay, so with that in mind, then, any of you want to start our discussion?
Sure, I'll go ahead and start. I actually forgot that I did write something. It's showing up in an anthology this fall, and it's literally about this. Gravity is interesting because gravity is the fundamental organizing force of our body. In fact, gravity plays a role in our basic development from embryos. But for instance, one of the things that came up was fluid control. In some ways, fluid control is actually easier because it just stays there. It just bubbles up and stays there right in the cavity. It's not spraying everywhere. Well, unless there's significant force, such as an arterial bleed. It's not getting everywhere.
First, please.
But on the other hand, we have, instead of the organizing force of gravity, pulling the blood away from the incision site, because again, the incision site's on top and the rest of the body cavity's on the bottom, the blood's right there.
So if you want to see what you're doing, you're going to have this giant bubble of blood in the way, making it very hard.
And now we're writing a horror story instead of a science fiction story.
There's space for that, and there are different ways to deal with it. You could have a siphon or something, a negative pressure device, but then you have to deal with your sterilizing issues, the one-use type tubing, and then the blood it's supposed to pool in the cavity, like Rao said.
Yeah, I know one of the things they've been researching is they kind of have these little, so like picture like a dome with a clear top, and they put it over the wound and they fill it up with some kind of a solution, so like a saline solution or something. And basically it keeps all of the blood in there where it's not going to be spraying out. But the problem is, so now you've sealed the wound, which helps to keep out, bacteria and such. But how do you get in there now to perform whatever, repairs you need to do? So they've come up with, they're trying to come up with ways of like, little, either you can do it laparoscopically, try to get in there with very small tools to try to, fix the damage. Or they've made like these little tiny robotic arms that are inside of it that you can try to control. But it is a big problem of dealing with, because there's no gravity to pull the blood away from the wound, you just have all sorts of issues.
Yeah, that's actually like something I think about is, I think about weird things. I'm a doctor and a sci-fi fan, it happens. But a gut is, if you've ever seen inside of one, it is literally 20 yards of hollow tubing. Now, when you stand up, it pools at the bottom. When you lay back, it pools on your back. In 0G, now you've got 60 feet of like basically wibbly wobbly snaky, like pool snakes in the abdomen just floating around. Like, I do not want to be the guy who has to find a gut laceration in there. And to go to your point of laparoscopic surgery are tiny little implements. You're not going to be manipulating the bowel out there. I think what you're going to see is, barring major advances in nanotech, a lot more conversion to open procedures. So instead of the little bitty ports, the big, across the abdomen, I think you're going to need that because of the way things are floating around.
So what? Two complications that you should consider also, when even just talking about the gut, is organ displacement, and so that affects diagnosis. So any kind of issue you have internally, it's harder to diagnose because things aren't in the same places that they would be.
So you'd have kind of displaced pain where you're like, oh, it's hurting, where traditionally you'd think that might be your kidney, but
no, yeah.
But who knows, with the way your organs are shifting,
And then another thing that is kind of funny to me, but our astronauts are often not surgeons. So you can't, based on the mission profile, you can't always send a fully trained astronaut up into space. So what happens is you end up with a crew medical officer who's had 40 to 80 hours of medical training, and you want him to use these tiny implements with an occluded operating zone. It's super complex. So what we do right now, you're going home. Get in the Soyuz, we'll fix you downstairs.
Yes, and that is basically, at the moment, if there's any major crisis, that is kind of the solution, is they put you in the little capsule, they send you back to Earth. But even that is a problem, because depending on what the medical emergency is, like let's say that your person is intubated and they need an oxygen tank, that's not going to fit in the capsule to send them back to Earth.
Don Pettit brought like 40 pounds of mission footage experience that he'd done back in the Soyuz, and it just about killed him because of the entry profile of the Soyuz. And the surgeons, they were so pissed at him.
Yeah. Or, just other practical issues. Like, imagine that you've got like a compound fracture in your leg. So, the bone is sticking out. How are you going to pack that person into their spacesuit?
And if you leave them in space, their bones are trying to remodel and remove bone loss, so that breakage isn't going to heal. One of the interesting comments, somebody asked about the centrifuge effect, And that has merit in many ways, but then you're in surgery and you've got the Coriolis effect, which means you go to make an incision and your hand
kind of
deviates
swerving.
because you're constantly in that rotational reference frame. It might be worth it. Maybe if you had a robot who wasn't, or you could correct for that, but
That becomes less important once you get to pretty large diameters. I think over
Yeah.
about 100-meter diameters, where you start to see that be less important but still present. But exactly, you've got this spinning force. So you've got a sideways force in addition to the downward force, and so that's always throwing things off. And now instead of a person with groupies all over the place, it's pushed to the left or pushed to the right. And
Well, and going back to what you said about the organs floating around, even something as simple like usually you have a person laying on their back on the operating table. Gravity's going to pull their organs down away from the muscle. So you can cut through that muscle fairly safely if you know what you're doing. But in space, you're going to have, like, the intestines are going to be floating right up against that muscle. So it's going to be very risky as you cut across the muscle. You don't want to nick the intestines because now you're causing, much worse problems than you started with.
you almost have like a combined solution written for you there. Super big spaceship with, you said, 100-yard diameter. I mean, that is really big.
Really big.
Like, the whole ISS is the length of a football field. That's not its diameter, that's its entire length. So, but if you could spin somebody up and robotically cut, and then spin them back down, and then maybe work with a dome, you might stand a chance of dealing with some of those problems. But it's going to be a much more complex solution.
But also, like you were saying, the healing process sometimes requires gravity, especially if it's a bone injury. And so then, do you just leave them to heal for, 6 weeks out in that little isolated gravity pod?
In regards to this, wouldn't a better solution would be to strap the person, or attach them to a frame? And of course, as you're making incisions, you need to make hooks, but once you need to make in a giant, basically intricate system, slice, hook, slice, hook, slice, hook, that way that you're attached to this, so that way there's not multiple forces, but you have everything pinned down. Like, wouldn't it be the best and most advantageous thing to just pin down? You got these organs, clamp, this is hooked up to something. It sounds barbaric, but you got to hold stuff down. But
Yeah.
you're both attached to this frame, and you
Well,
work.
and
Wouldn't you
part
need
of
to be
what's-
in the same?
Reminds me of that scene in Speaker for the Dead, where they're dissecting the Pequeno.
Yeah. Well, and part of what's hard about it is you may be right, like that may be the direction we need to go, but how are we going to practice?
Pigs and sticks.
actually think it's
volunteers.
Do you know what kind of? So yeah, were we talking about,
Yeah, we
about
were
this
talking
yet
about
last night? Volunteers. So anyone seen Lockdown? I'm not saying it's right, but okay. One person raised their hand, so I can't make that joke. Lockdown is a movie about a prison in space, which has all kinds of like logistic problems, like mass to space cost right now is super big, so that just makes no sense. But yeah, we don't really want to operate on
We also
convicts.
talked about Russian space pigs.
The Russians maybe don't have to deal with PETA. So we have a rats experiment, and there's all kinds of sensitivities. By the way, I should say I'm not here as a representative of NASA, so I gotta be careful about what I say.
I will say it's actually harder to do animal research than research on children. So in some ways, in some cases. So.
Yeah. And I know they have done, I don't know if it was rats or rabbits, but some kind of small mammal that they did do experiments with, cutting them open and seeing what happened with the blood. And apparently it was a bloody mess. Like, because once the blood escapes, there's no gravity to
And by the way, this is the
Take care of it.
same problem with like inhalants that you use for anesthesia. So by all means, if you want your doctor to be as high as your patient,
yeah.
release that anesthesia
Yeah.
into the atmosphere and have it come through the filters multiple times.
Yeah.
That actually happened in my old hospital once. Yeah, there was a leak in the hose, and everybody
felt
got a
really
little
good
bit too
that
much
day?
sevoflurane. It was pretty funny.
With the anesthetics, yeah, doing any kind of a gas anesthetic is problematic exactly because of that. That once it's in your air supply, the filters aren't going to be able to scrub it. So
we wanted to talk about solutions. So I don't know, put the person in a bag and administer it. I mean, you have different problems with distribution if you do it intravenous as well. So some of the papers that I've read talk about you do a combo. Maybe you do some inhalants in a very, very controlled environment. You have to design a system for that you don't have to scrub.
Yeah.
And do an intravenous solution to kind of get a more full effect.
Yeah, and from what I've heard, they think that ketamine might be a good.
I was about to bring up ketamine. Ketamine, and honestly, for that situation, inhaled anesthetics, there's some consequences to them that you don't necessarily want on a space station. Inhaled anesthetics have a really high rate of vague cognitive problems. So these are people that live and die on their brains, but you might wake up a few IQ points dumber.
You could do it to your crew met.
Yeah, funniest conversation I ever had with an anesthesiologist was they were just seeing me as a patient, and I was like, no inhaled anesthetics. And they were like, why? They're perfectly safe. And I go, I'm a doctor. And they go, oh, never mind. Yeah.
What are the consequences of using something that's like an albuterol inhaler where it's got a propellant and it's closed and you inhale, and you have to have a conscious patient, but is that possible?
When you use an inhaler, how much of that is captured by the body, by the system, and how much of it is then exhaled? That's a question you'd want to answer.
Well, that really depends on how long I hold my breath after I inhale.
Yeah.
How long can you hold your breath in space? And we can put you in an airlock and test. But
Especially if you're in significant pain.
I deal with chronic severe pain, so I know I can hold my breath for over a minute.
Well, I mean, I would imagine it is better than just a general, face mask anesthetic.
but
it would still be problematic.
I think you're still going to have some escape.
What about strong alcohol, like they did back in the old days?
Get your astronaut drunk.
We may actually have that, but it comes up with the Russians. I'm actually only a little joking.
So, like, the med combo I would use is actually the ketamine, but also a drug called Propofol, which is basically IV alcohol. And it's really cool because it works pretty quickly, and it stops working pretty quickly once you stop the flow. And Propofol is really well tolerated by the vast majority of people for short or long procedures. I'm still not, no one gives me a good reason why we don't use it more. But that's exactly it. Use alcohol, but just a fancier doctor.
Well, and I mean, one of the issues you mentioned, IVs, is IVs are also problematic in space because on Earth they're gravity powered. Now we can get around that in space, get some kind of a pump on there that's applying pressure. But one of the other issues is on Earth, the little bubbles that get into the IV solution, like they raise to the top. And so it's only the fluid that's going into your veins. In space, any air bubbles that are in your solution, they're just going to stay where they are. So you have the risk of causing embolisms by pushing those bubbles into people's bloodstreams. So you'd have to find some way to, centrifuge it before you were administering it. I mean, it gets complicated because you'd think, an IV, that'll work in space, but not really.
Kind of like a crossover to another panel would be the industrial aspects of having bubbles and things. Like some of you probably thought of this, but you can make styro steel, which is basically a steel structure with suspended bubbles in it. As it cools, you've got a super light steel that can be used for manufacturing, and you don't have to up mass as much material. But that doesn't help the bubbles in the blood problem. Let's go with Joe.
This is maybe a little bit of a change of direction, but I'm a little bit curious about reproductive health in space, like pregnancy, delivery, those complications that you would see.
Do you know, have they done any animals? Like, have there been any gestations in space?
No, I don't think so.
I looked it up
I'll
about
put it on my list.
10 years ago, and there hadn't been any about 10 years ago.
There weren't when I wrote this.
I mean, I know for sure, like, humans, no, we haven't.
And they get mixed results when they send, like, pregnant mice up and they come back. Sometimes the babies are okay, and sometimes they're really sickly.
Yeah. I think one thing that we know is that the inner ear formation gets pretty disrupted without a gravity environment to to make that happen. Several aspects of pregnancy would definitely be easier in microgravity. I can
Third
imagine.
trimester.
I beg to differ. That first trimester where the stuff is coming out every morning, like, you can't clean that up.
No, I'm saying the third trimester would be nice in space.
Yes.
You'd just be floating.
Yeah. On the other hand, delivery could be problematic again because you've got this baby floating in a chamber. It's not going into the funnel.
And the fluid.
Funnel is a technical term, by the way, for the birth canal.
Also slippery.
You just don't have. It's like you ever pushed on something inside a fluid bag, and then as soon as you remove the pressure, it goes right back to where it was. That would be a big problem.
Yeah.
Yeah, if your water broke in space, how would you know?
It would pool.
Well, would it even come out of you?
No, probably not until you sneezed or somebody told a joke. Which is why I'll never go to space.
For the initial injection, could you do like an ultrasound guided, Nick? Just put an ultrasound up against there and see if there's any intestines, and then like pull out the intestine to try and push the intestines away and poke in.
I think that ultrasound machines are part of the equipment that they have
It is,
up on
yeah.
the
Yeah, they have
station.
ultrasound.
And then once you're in, you can use a scalpel guide underneath the skin to get away from the intestines.
And then, so one of the problems to solve there is, what are the protocols for ultrasound Nick, developing something with enough reliability that you'd want to use it in a long duration environment, which is something we should probably talk about towards the end. JL, did you still have a question?
Yes, one of the big issues, matter of fact, I almost lost an astronaut last year, is aspiration of fluids.
So if you're not familiar with this, Luca Parmitano, they had a problem in his suit. It started bleeding water, and the water pools at the back of his head and starts to creep across the top of his head until he has this bubble that's like right here.
Yeah.
And you've got a mask on when you're in an EVA suit. This is not like in the station, he's in an EVA suit. So you can't wipe it away. The only recourse you have is to shake your head, but then the water goes in weird places. And that's curtains. If that water comes down, you can't get it off. You can't deal with that.
That would be a great scene in a book, though.
But you also have the same problem in the ISS itself. For example, when they're doing going to the bathroom or trying to clean up, when you have water or fluids that are escaping. And when you start aspirating that, now you've got a bigger issue. And how would you deal with that?
Yeah, well, and going back to just the fluids in general, like, it's not uncommon when people are in pain or getting surgery or anesthesia to vomit, right?
Yeah.
Like, that is very common. And vomit in zero gravity is an issue for everybody.
Yeah.
Because it goes everywhere. And I mean, there's the problem of, like, while it's happening, you've got clouds of vomit, but then how are you going to clean it up later? Like, it's...
Yeah.
Sawdust.
Yeah. Oh. Okay, Clark, sorry.
So we've talked a lot about prepped surgery. I guess I'm curious how the operation or procedure would change if it was on-the-spot trauma surgery. If there was like a sudden deep laceration, like how would they handle that?
Depends on where you're at. So this again goes to the type of story you're writing, right? Are you writing a lower Earth orbit story, or are you writing a distance? Because what we would do now, I'm thinking off the top of my head, is you'd call downstairs. You'd say, we have this situation, and many of you have probably seen Apollo 13. That's how mission control works. There's a problem in orbit, you call downstairs, you get all the smart people in the room that you can, and they come up with a solution as fast as they can that then your technicians or mechanics, because that's what our astronauts are technically, they're basically glorified mechanics, and they do some science, but they keep that ship running. And they do not have all the know-how to solve all the problems.
Okay.
Oh,
I didn't mean to interrupt you.
No. So that's how we'd solve it in a lower Earth environment. Long duration, though, that lag time for any kind of science fiction, you should consider lag time, because even if you've got a robotic operation, where's that data coming from? You're going to have a data threshold. How many scenarios can you pump into that computer so that a local robot can do the job? Because if you have to call back to Earth for help, if you're going to Mars, on a good day it's 8 minutes lag one way. On a bad day it's 20 minutes, 22 minutes plus.
Trauma stabilization is actually really interesting because you can stabilize someone with horrific injuries for hours with the right equipment, with IVs, with hemorrhage control, with pressors, with things like that. And you know, most stabilization actually happens in the field by people trained to the level of paramedic, which is about an associate's degree level of training. So that's something that can actually be done, and then we have hours, we have time. So in a low Earth orbit scenario, you're thinking, can we get them into an escape capsule? Can we get them back down to Earth? And the kinds of injuries we can't stabilize are also the kinds of injuries that you have to ask yourself if, even in a more sort of robust space station type setting, would they even have the kind of doctor who could do that? There are 2 pediatric heart surgeons in all of Florida. That's for 35 million people. So start thinking about these numbers, and because I'm thinking about heart because that's one of the things where you can't stabilize someone without just getting in there and stitching up a heart lag. How big would a space station be to actually have someone trained to do that?
And then you not only have the expertise complication, but you also then have the complication of being in outer space. So even if you did have one of those 2 Floridian heart surgeons in orbit, they're in an entirely different environment that you have to adapt to. All sorts of things behave differently. We have astronauts who come home, you know, and they're used to eating and leaving their plate here. And they come home and they leave their plate and crash. And so you develop intuition over time being in space, just like you develop intuition over time being in lower Earth orbit. And the problem with a pediatric heart surgeon who's got tons and tons of experience on Earth, that split-second intuition is going to be different, or it may not be accurate or apt to the space environment.
Well, and there's also a lot of physiologic changes that occur, like even before your injury happens. Just being in zero gravity, like they tend to have like less blood volume, less red blood cells, their bones are brittle, so they're already in a condition that, you know,
less optimal.
Yeah, like it's not a good condition to be in when trauma occurs, and so then when the trauma happens, you just have extra issues to resolve.
So when we get to the point where we're sending a lot of people in space, might we have specially trained zero-G surgeons, in the same way that, you know, you have flight surgeons?
That is a great place to go for a science fiction novel, honestly. And you got to ask the question: what is the economy that would? I mean, it depends on your audience, right? If you're writing for kids, don't worry about it. If you want to write hard sci-fi, you want to consider what is the economy? What are the numbers? What are the percentages where you would start to see microgravity surgeons?
I missed. I think maybe you did answer it, but again, I come back to: would it not be simpler just to have the ship spin around so you can get?
That's a huge ship.
You
have to have a. Sorry.
Oh no, I was just going to say, at the moment, we don't have stations that are big enough to make that work.
Oh.
I mean, obviously, in science fiction, you can have your society have any level of tech you want, but if you're doing a near future sci-fi, then we're just not quite there yet.
More interesting for me, and like if you're writing kind of harder sci-fi, would be, okay, we can't make this big ship. We know the Coriolis effect exists. How are you as a writer or an author going to come up with a solution to that? Write something, maybe a draft, and try and find somebody with the technical expertise to talk about it. What do you have a robot do part of the procedure? Do you have specially trained Coriolis effect surgeons? I mean, it's interesting to me to see how you would solve that problem.
Yeah, one of the other potential solutions, if you're in a spaceship rather than a space station, is acceleration. Because if the ship accelerates, that will also produce artificial gravity.
And then you don't have a Coriolis effect.
And then you don't have a Coriolis effect. So it could be something as simple as turn on your thrusters. We need to accelerate during this procedure.
Well, but then you have to worry about where's the ship going.
Exactly.
during
I mean,
that
there's
time.
other
And the
problems.
surgery could last for hours.
Recalculating.
But I mean, that
Siri doesn't do well with that.
would be an easier solution, assuming that you have the fuel to do that without jeopardizing it.
And I love that just came out, because that didn't occur to me until we started having that discussion. So that's brilliant.
That is. I'm just imagining the captain shouting, "Engage surgical speed."
If you're not going to use that,
Yeah.
Okay, in the very back.
Just wondering, going along with that, would it have to be 1G or could you do half a G? What would the acceleration have to be for it to work?
Honestly, any gravity would be better than none. I don't know that you'd need a full 1G, but I don't know.
yeah, I don't either. I mean, at some level, you stop sensing the difference, right? You might feel a little more athletic in 0.8 or 0.9. That might be enough. But I don't think you'd need to go to 1 unless you had very specific. If you had a limited protocol set, then you'd have to go to 1G, right? If it's a protocol set that's only been developed for an Earth environment, then you'd have to accelerate to a certain rate. If it's something that you studied and practiced, depending on your economies, in a lower G environment, then maybe you don't have to accelerate as much. Oh, sorry.
Is there any reason you couldn't just do the ship cord center point counterweight and spin that to avoid the Coriolis effect?
That's another good solution to deal with the size issue, right? So if you don't want to have a 100 diameter ship, you put 2 Orion capsules on the end of a long spinning cord. There are issues with that, but
like what? Like
I don't know.
Something happens to the cord.
I have read, something hits the cord. I've actually read about this, but it's not at the forefront of my mind. If you get with me
Can I
after.
pester you afterwards?
Yeah, or just give me your email address and a list of questions, and I'm going to lunch with a friend who does this stuff, and he may have a good answer for me. And if he doesn't, I'll see if I can find it, or I'll give it to those guys too.
Okay, so one question that I wanted to make sure got answered. We've talked a lot about how the fluids are a problem. How do they clean up fluids in space? If the blood gets out, if somebody vomits, what do they do? Because you can't just use sawdust.
So to be honest, I'm not aware of any significant blood release, but the de facto answer is suction.
Okay.
Yeah.
Just vacuum.
And I would imagine some of it probably ends up in your filtration system, wouldn't it?
It would smell terrible.
I mean, tools would have to be built like Flobies, like the old buzz your hair and have it sucked up. They'd all have to be essentially built.
Well, and that's another solution set, right? Every tool that you have in a surgery environment has some kind of vacuum, so it's like going to the dentist, but your scalpel has a little sucker in your.
I do also want to point out before I forget that we're talking about all the challenges of microgravity, but there's also some benefits to microgravity. If you've ever been in a medical emergency where everybody's running around the bedside, I get used on the pediatric hallways because I can stand behind someone and still hold something over the OR field with my giant monkey arms.
So you can leverage more. You can leverage more.
Space is a problem.
Yeah.
So, like, literally, they're like, "We need Dr. Rao," and I'm like, "What? The patient's not conscious. They need me to hold things."
Imagine like 6 people basically standing upside down over the body.
And where are we most precise? It's actually not doing this. It's doing this. And so now I, as a surgeon, can stand at 90 degrees to my patient. And
that's cool.
I can have something over here, something over there, and all of a sudden orientations are actually more beneficial in some ways.
You can leverage more support on the situation. You could have 2 or 3 surgeons in action as opposed to just the one.
And I can't think of any specific examples, but something you may want to research. There may be current medical conditions on Earth and procedures that would be easier in microgravity. And so having a novel where a patient is flown to a space station for an operation, because they can do it there, it would be interesting in a novel.
Oh, virtually anything orthopedic, I would love to do that in space and then fly them back down for healing. Almost any orthopedic injury, I think, would be better taken care of that way.
There's a joke about a dentist here releasing laughing gas. Everybody.
Would you design a special stretcher so that you could get out the patient from 360 degrees from any angle? Maybe. So that you just have them float in the middle of the room held in place.
Yeah, you to tie their wrists and ankles, and then you've got your horde
I was gonna say,
all over.
One thing before we take another question that we haven't even mentioned, but is bacteria in space. Okay, so here on Earth, gravity helps to kind of keep bacteria out of the air, right? So, I mean, bacteria gather on surfaces, so doorknobs, the floor. But in space, there's nothing to keep these microbes from just floating around everywhere. And so the risk of infections in space is a lot higher, especially because the air just keeps getting recirculated. You're gonna have all of these microbes, and in space, bacteria grow faster, and they often appear in more virulent forms, so they're more dangerous. They did a study where they sent salmonella up into space, and the strains, it caused mutations that made the salmonella 3 times more dangerous.
Why are we back to horror movies again?
Yeah. So, I mean, there's also issues with, bacteria and sterilization and those kind of things.
Was the bacteria mutations from radiation?
From what I've read, I'm not an expert, but they think that being in 0G triggers the bacteria to go into like emergency crisis mode, which triggers changes in the DNA that just make it more dangerous.
But there is, I mean, that's always a problem in space. Is the radiation levels create greater create larger incidence of mutation.
So there are already surgeries that are done with, robotic instruments with the surgeon in a different state over the internet. With current technology, do we have data links fast enough that you could just have your expert surgeons performing the surgery on Earth?
If you're in low Earth orbit,
and any further away, I mean, you were talking about Mars.
Yeah, he was saying Mars is what you said. 8 minutes.
But you still have a problematic lag time going to the moon.
Really?
1 second.
Which is measured in seconds.
Well,
almost a kilopage.
especially because you're gonna have to do something and then kind of see what happens to make your next decision. And so it's not like you can just program the whole thing in, because while you were doing this, the patient rolled over and you didn't know for 30 seconds, and now you just cut their heart.
Yeah, and even if you have them strapped down, there's still problems.
Well, you only find out what you did 8 minutes later.
Yeah.
Specifically in a Mars scenario.
Yeah.
JL, did you want to add or?
Yeah, this is for Nick. At what point do you change the protocols on who you try to save and who you don't?
Yeah, that's I think the big question in all of this, and that's kind of one of those hard realities of a resource constrained thing that we're talking about here, is literally if we start to spend the resources to put a surgeon into space, we have taken away from other resources that might jeopardize the entire mission's viability.
Every mission's optimized.
Yeah.
So we have a crew medical officer sometimes who's got basically 80 hours max of paramedic type training, and in a long duration, you're probably gonna have to do better than that.
Yeah.
But
still, at some point, you've got to say.
There's a famous short story, the cold equations. Is that what it's called?
Yeah.
Anyway, I can definitely see situations where you would have a patient that could be saved on Earth, but you would have to let them die because you don't have the resources. It would jeopardize the mission, and I can definitely see that happening.
And at least in our environments now, with the limited crew sizes that we have, losing a crew member is going to destroy everybody. In sort of a war, expected mortality rate high kind of scenario, it still affects people, and it still affects people significantly. But we're talking about predominantly intellectuals. And so you've got way bigger problems. Well, maybe not way bigger problems, but you've got big problems in it. If you let somebody go, how does that impact your crew? How does that impact your ground crew?
I could imagine you might have to just can the mission at that point if somebody dies like that.
You've emotionally compromised this group of people, and so, you know, if you ever get a chance, watch the footage of the mission control when Columbia is lost, and the flight director is just about ready to bawl. He's locked the doors, you know, everything goes on lockdown, and it's a horrible moment.
Well, it's the same thing on Challenger.
Yeah.
Just to answer Jim's question a little bit more clearly, I have the dubious honor of being on the transplant board, which means I'm one of 3 voting members on whether a kid gets a new set of lungs. Sometimes we say no, and that tears all of us apart. But we make that decision based on what's the upside to that patient as well as every other patient around.
The opportunity cost.
And so we always think about a transplant as 3 lives. The life of the donor, the person who died to give us these organs, the life of the recipient that we're talking about, and the life of the recipient that it could have gone to. So in a space scenario where we are talking about resource constraint, it is about, by doing this, what am I doing to hurt other people? So you can imagine, for instance, a surgeon looking at someone and saying, I can spend literally half of my medical equipment here to save this one life. But that means that for the next 3 years, I've got half as much equipment.
Yeah.
And so I think it's that calculus, and it sucks, but I've done it.
When you go back to the bacteria question, right? Like, the buggies always win.
Yeah.
So a lot of this equipment, how are you going to sterilize it? How are you going to get into all of the tubing and all the little places that could have been impacted?
Right.
Well, and one thing that I was reading that had not occurred to me before is with medical equipment, anything in space, there is a great cost. Like every gram you send on a space mission matters. And so you're not going to send 500 pounds of medical equipment.
And by the way, that 500 pounds, or that maybe 5 pounds of medical equipment that you do send, that ultrasound, maybe not so much, but it has to go through, like, to put an iPhone in orbit was like unbelievably difficult because they had huge issues with the batteries. So that basically, I may be saying this wrong, they had to remove the manufacturer battery and use a battery that had been tested and retested and tested and retested, that we could be sure wasn't going to cause a fire in a closed system environment.
But the solution that I had not thought about until recently is 3D printing. That now we have the technology, we can just send up, you know, some carbon, some oxygen, just the substances, and then when they're on the mission, if they're like, oh my goodness, we need this special scalpel, you can print it. Now, obviously, that's not good in a crisis where you have to wait for the 3D printer to make the tool, but it does allow you to have medical equipment.
Well, the extension of that is you can then melt down the tool.
Yeah, when you're done,
and
reuse
it, and you're going to kill you're going to solve your sterilization problem, hopefully, in the process of recapturing the hard matter for that tool.
I was actually imagining us putting like a tray of surgical equipment outside to be baked by the cosmic rays and frozen.
Funny story. Does anybody know what water bears are?
Yes.
Tardigrades. So those suckers, we put them in a petri dish, we expose them to a vacuum, we expose them to radiation, we brought them back inside, those suckers started having babies again.
So basically what you're saying is water bears are immortal?
Yeah, they'll be long after we're gone.
Well, there was a recent NASA experiment where they managed to kill one, and that was like a big deal. And they've been messing with water bears since before I was born. But by the way, a lot of what makes water bears really, really resilient to all these things is stuff that totally could be genetically engineered into people, and not just in a fanciful way. Like, give me a CRISPR machine and someone I kind of don't like, and I can
splice me with a water bear, please. We are out of time, I think. So, any last thoughts?
Where can we find you?
Email is probably the easiest way. NikhilRaoMD@gmail.com. I will someday have an author page, probably by next year, but
bkhewett.com, or come and talk to me afterward.
And I'm thedarcy.com, so TheDarci.
Thanks for coming, guys.